Hey, it's Tom
And Mike.
from Take Time to Travel. Sorry it's been a while since our last video. It's been a crazy start to 2022.
We've been busy with doing lots of tests and scans for Tom's prostate cancer, which have taken us on a roller coaster ride of emotions. In our last cancer update video that we posted back in the beginning of December, we had mentioned that due to Tom's unusually high PSA numbers, the doctors had ordered a prostate biopsy, which unfortunately did identify an intermediate grade prostate cancer with a Gleason score of 3 plus 4 equals 7.
We also mentioned that the doctors wanted to make sure that the cancer hadn't spread, so they ordered a bunch more tests, including blood work, bone flow, bone scan, and a CT scan. On the bone scan with bone flow and the CT scan, the doctors did identify one area on the rib which was described as highly suspicious for metastasis, which means that they found an area that looked like the prostate cancer had spread to one of my back ribs.
The first doctor advised us that due to Tom's unusually high PSA, which didn't really tie in with the amount of cancer in Tom's prostate, that it was very likely that the cancer had spread, and that the other doctors were very likely to treat it as such.
If the cancer spreads to the bone, then it's no longer curable. It can only be treated and monitored. This was a huge change from our original idea that this was going to be a quick and relatively easy and curative process with a very high chance to eradicate the prostate cancer.
As we talked to the assistant of the other doctor who would actually be doing the treatment, she advised us that it was very likely that the cancer had spread to the bone based on Tom's high PSA.
But to be sure, they wanted to do a prostate-specific membrane antigen PET scan, or PSMA PET scan, which is part of a clinical trial as it's not approved yet in Canada.
For the test, they would inject a radioactive dye into Tom's blood, which would bind with the prostate-specific membrane antigen, which is a protein found on the surface of the prostate cancer cells. During the scan, the dye, which binds the PSMA cancer cells, would light up brightly, and this would be able to tell the doctors whether or not the prostate cancer had spread to Tom's rib, or if it had spread to anywhere else in his body. So we decided to try to do the PSMA PET scan, which involved signing some paperwork and actually applying to try to get accepted into the trial. Luckily, it was free, and he got accepted into the clinical trial. Shortly thereafter, Tom was able to get the test done pretty quickly and easily.
Just last Wednesday, after the scan was done and the results were in, I had the opportunity to go into the hospital and talk to my doctor in person to go over those results and finally start planning my treatment.
I was there too, kinda. I was listening in over the phone. Thankfully, the doctor advised us that based on the results of Tom's PSMA PET scan, it looked like the prostate cancer had not spread to Tom's rib or anywhere else on his body. So thankfully, we're back to it being curable. Woohoo!
What a relief! Next, we discussed with the doctor the treatment plan. We decided that the course of action with the least long-term side effects would be to apply for and try another clinical trial.
This time, it's for focal high-dose rate HDR brachytherapy, which is where they use a targeted procedure to implant high-dose radioactive seeds into the cancerous area of Tom's prostate. Now, they'll leave these seeds in there for 5 or 10 minutes or something before they take them back out, all within the same procedure.
Thankfully, I'll be knocked out for this. Then in combination with the high-dose rate brachytherapy, about a week later, there'll be targeted high-dose external beam radiation for 5 sessions over 10 days. Right now, it's looking like I'll be done all the radiation treatments by the end of March, which I'm thrilled about. It'll be so nice to get this all done and over with. Now, before I start the high-dose rate brachytherapy and the targeted high-dose external beam radiation, there'll be a procedure to insert spacer or hydrogel, which will help protect nearby sensitive areas from radiation splash damage.
Unfortunately, this spacer hydrogel procedure is not covered, so we're going to have to pay out of pocket for this, which will cost about $3,500. But we think that long term this will be a great investment to increase the chances of a better quality of life for years to come and reduce the risk of unwanted side effects.
During the treatment, I'll also be doing hormone therapy, which is done by needle. The hormone therapy essentially blocks my body's testosterone, which is the food source of the prostate cancer. I'll be doing 2 of these hormone therapy shots 3 months apart for a total of 6 months.
Luckily, last Wednesday when Tom went to the hospital to talk to the doctor, the clinical trial coordinator was also at the hospital. So Tom was able to start doing some tests straight away to make sure that he was a good candidate for the clinical trial. While he was at the hospital, he did some more blood work, an ECG, and some other tests. Then, he signed some paperwork, some consent forms, and he was accepted into the trial same day.
Now there are a few more planning scans, which are CT scan and an MRI to be done for the exact targeting and treatment of the cancer. But it sounds like this should start to progress very quickly.
We are very much looking forward to getting this resolved, getting rid of Tom's cancer, and getting back to our regular lives. In the meantime, we have a couple of Montreal videos that we'll be posting during Tom's treatment, as well as a Valentine's Day video. Then, hopefully, we'll be back to posting our regular travel and food videos.
Thanks so much for watching. We really appreciate it. We'd also really appreciate it if you would like, subscribe, and hit the bell for notifications on our future videos. It really does help with the YouTube algorithm, and it helps our channel to grow.
And remember, take time to travel. Catch you on the next one.